This was the last photo with my mom.
Josephine Machito was a lifelong Blue Jays and Broadway fan, and still healthy and mobile well into her 80s. But after a brief bout of COVID-19, she passed away in hospital on October 9th.
I don't think I ever thought I was going to lose her to COVID. In my mind, she was going to die in a few more years.
Data show weekly COVID deaths in Canada haven't dipped below 137 throughout all of 2022, and in recent months they've climbed higher. During the week of October 16th, 305 Canadians lost their lives.
For those at risk, the pandemic continues to be a real and legitimate threat.
During earlier waves, younger, healthier people were among those winding up in ICUs. But multiple clinicians who spoke to CBC News say that's no longer the norm. The Canadians getting sickest and dying from COVID now are typically elderly or have compromised immune systems or other medical conditions.
I do think that the population that is getting really sick has changed.
What hasn't changed is the pressure on hospitals.
We simply cannot expand any further, and we don't have the resources to go into the season.
I want to ask you guys, have you had your flu shot and your COVID shot yet?
This geriatrician says it's important for seniors and their loved ones to take basic precautions, both to protect Canada's elderly and the country's fragile healthcare systems.
I'm certainly not telling any of my older adults, don't do anything this winter or fall. I mean, the loneliness will just kill you alone. It's more the idea that try and live your life, but try and do so safely by getting vaccinated.
But you got to float on the beach.
But it's not always enough. Josephine had 4 vaccine doses, and COVID still took its toll.
It's like people have forgotten that there's people out there that are, it's hard for them to recover from this.
So when people are this sick, what does that do to the strain on hospitals?
Well, in the early days of the pandemic, some of the sickest COVID patients were winding up in the ICU. And now that strain is spread out over different hospital departments, everything from regular wards to the emergency rooms. So we're seeing it kind of broadened, all while hospitals are still catching up on backlogged surgeries and procedures. They're dealing with staff shortages and the return of a regular respiratory virus season, everything from RSV to influenza. So what we keep hearing from doctors is anyone we can keep out of hospitals right now, the better.
All right, Lauren Pelly, thank you.